All right. Well, welcome everyone. It is a beautiful day today. I am Erica Narducci, the Program Director of Cancer Support Community Delaware. It's hard to believe school is starting. It's almost September and that Labor Day is this coming Monday. But because we're facing this new season ahead of us, I have asked Dr. Philip Margiotta to be with us today to talk about facing the fall, and give us some COVID and other updates that I think are important at this time of year. So, Philip, I will turn it over to you.
Great. Thank you for having me. I'm very happy to be here and participate. My name is Philip Margiotta. I'm one of the new medical oncologists here. I just joined the ChristianaCare Helen Graham Cancer Center. I'm a native of Delaware, was born and raised here, graduate of the University of Delaware. Moved around a little bit to Philadelphia and Baltimore, not too far, but for my medical training, but I'm now happy to be back here, where I call home, close to family. And then here today to kind of talk about, updates on COVID and then other updates as we enter the fall. So to get started, I just want to talk a little bit about COVID and where we've been. So this is just a digital representation of the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, which is the virus responsible for COVID-19 syndrome and the pandemic that we've gone through over the last 3 years or so now. So I thought this was a nice chart from the CDC that just shows kind of the impact that COVID has had over the last 3 years or so. So to date, we've had a little more than 1.1 million deaths in the US from COVID. As you can see, a large number, probably a little more than half or so, were in the first year or so. But we've continued to have patients with severe illness and death related to COVID, even over the last few years, as we've had, varying treatments and preventative strategies, which I'll go over. So this is another representation. So the blue bars are hospitalizations, and you can see the original wave of hospitalizations in, mid to late 2020 and early 2021. And then kind of another wave of hospitalizations in early 2022, which was the Delta, when the Delta strain was prevalent, and then there kind of was a second wave of hospitalizations. And then as you can see now, we are having, another uptick in at least the number of positive COVID cases, especially over the last month or so. Not a huge increase in the number of hospitalizations, but something that we'll need to keep a close eye on as we go forward. This is an updated map of the US and where the number of cases are most prevalent. And so, in the southern part of the US, higher prevalence of COVID. Up here in the Northeast where we are, we're still in mostly the lower zones, although it seems to be increasing kind of throughout the country. So I wanted to talk about next, what we can do to prevent, our patients, prevent family members from getting sick, from getting COVID or other illnesses for that matter. Because, the most important thing for me as an oncologist, for my patients, we know patients with cancer, they can be sick from their cancer for a variety of reasons. And having cancer or going through, intensive treatment for cancer can make patients, more susceptible to infections or other illnesses, or more likely to have severe illness if they were to get COVID or other infections. And so the best thing we can do is to try to prevent infection. And there's varying layers or strategies that we can use. So the first thing, or perhaps even the most important thing, is using good hand hygiene. So washing your hands regularly, especially if you're in contact with other people, you're touching things. You just don't want to you want to clean those germs off as best you can. Avoiding being around other people who are sick. So if you have family members or friends, who have respiratory symptoms, or who have children who have respiratory symptoms, being a little bit extra cautious. So we're still in the summertime, people can stay outdoors. So staying outdoors is a great strategy. If you're going to be indoors, staying in areas with ventilation, keeping the windows open, fans, or just limiting your interactions to smaller groups or around people who you feel comfortable, with what based on your risk tolerance. Some higher risk situations would be areas that are enclosed in large gatherings, so things like airports or airplanes, or sporting events that are inside where you have large gatherings of people. And then in addition to that, we have some the next thing would be mask wearing. So over the last couple of years, we've all worn masks at times. Where we stand today, here at the Helen Graham Cancer Center, and in most areas nowadays, I think masking is optional. There's certainly never a wrong time to wear a mask if that makes you feel more comfortable. And I always stress that to, patients and family members. It's never wrong to wear a mask. The CDC gives some guidance on when mask wearing would be, a higher level of recommendation. And that mostly is based on the number of COVID cases or number of COVID hospitalizations in your area. So for patients, our patients with cancer who I would say are at higher risk for getting very sick if they were to get COVID. So for them and their family members, when the COVID levels go up to even medium or high, we would be more likely to recommend that they wear masks. This is a map of kind of where we are today. And in most cases in the US, the number of hospitalizations are low, and in our area in particular. But I do always stress to patients, it's not wrong to wear a mask, especially if you're going to go in situations that are maybe higher risk. So, gatherings of large people, being in areas where you're not sure, wearing a mask, is the safest thing to do. The next thing I wanted to touch on was vaccines. So, the vaccines first rolled out towards the end of 2020 or early 2021. So it's been a couple of years now. And, a lot of us have been able to get the original vaccine series as well as a booster, and then even more recently, the bivalent booster. And as of now, the plan is that there should be a COVID-19 vaccine available in the fall. Should be available hopefully by the end of September, if not early October. And this was, designed to target it's a monovalent vaccine that targets one of the Omicron lineage COVID viruses that, it's believed should provide great protection against the strains of Omicron that are going around right now and should be going around in the fall and winter season. Why this is particularly important, we know that over time, even with the prior vaccines or with prior COVID infection, we have waning immunity, which means the effect of the prior infection or vaccine kind of wears off, and so we need a booster to remind our immune system and help us fight the COVID virus if we were to get another infection. This is particularly important for our cancer patients who, are at higher risk for having severe outcomes if they're to get infected, and also who may have a compromised immune system in a sense that they may not respond as well to prior vaccines, or their immunity may not last as long. So this may help them, boost that immunity, especially as we go into, the fall and winter where there's more likely to be infections going around. So this is something that I will certainly be recommending that all my patients at least consider, updating their vaccine with the new vaccine when it becomes available.
Before we go on, I just wanted to say, and will you recommend it for caregivers as well, because they're, exposed to our patients too?
Absolutely. I think it's probably almost as important for caregivers, family, friends to also be vaccinated, because, while the vaccine can help protect our patients, they often, need to be around and want to be around family, friends, caretakers. And if they're sick or have symptoms, it can be more likely that, no one wants to get their loved one sick, but we're all exposed. And so, yes, I think it's very important for the patients to talk with their loved ones, and, everyone to consider getting the vaccine. And then this is a chart from the CDC about other vaccines to consider. And I think it's important to talk about because, it's great that we have a COVID vaccine and we've come a long way in terms of, treating and preventing COVID, but there are other illnesses that have been around for a long time that can still cause severe infections in our patients. And so things that we can prevent and that we don't want to lose track of. So the most common one is, the annual influenza vaccine, which has been around for a long time, is very safe and something that even before COVID, we were recommending for our patients. And, I'm still recommending that all patients and their caregivers, loved ones consider, and strongly consider getting each year. They can be given at the same time. So, once the COVID vaccine comes out, you can go to your primary care doctor, your local pharmacy. You should be able to get, as long as they have them, you should be able to get both vaccines at the same time. Some people worry about, the risk of side effects getting two at once. There may be a slight increased risk of some of the side effects, like, injection site reaction or mild fevers, things like that. But you certainly can get both at the same time if that's easier for you. And it doesn't, compromise the effectiveness of either vaccine. Some other things to consider, just within the last few months, actually, there was an RSV vaccine that was approved for adults over the age of 60. RSV is another respiratory virus that can cause, respiratory tract infections like pneumonia, especially in our older or immunocompromised individuals. So something to consider for all of these. I recommend that patients discuss this with their oncologist or their primary care doctor. Family, friends, caretakers also discuss it, with their primary care doctor, because we don't want to miss out on these opportunities to prevent, what can be severe or life-threatening infections. Just a few others to highlight from this page. I know it's a little bit busy, but there's a newer recombinant zoster or shingles vaccine. So this is recommended for all adults over the age of 50. It prevents reactivation of the virus that causes shingles. And even if you've had shingles in the past, you can actually still get shingles again. So it's still recommended that you would still get the vaccine. Other important ones, the pneumococcal vaccine, especially important for our immunocompromised people, because this can cause severe pneumonia and even invasive infections. So that would be one, to make sure that you are up to date on, and you can always talk to your oncologist or primary care. These are readily available vaccines at this point. So I think the most important thing that I wanted to kind of highlight today was the most important thing is that we keep our patients safe. We know that cancer, is an aggressive disease, and we often have to treat them aggressively. And so we need to keep them and keep their body in the best shape possible so that we can do everything we can, to treat them and fight the cancer. And many of these things like COVID or other infections, our patients are at higher risk for getting infections or for getting more severe infections that can really compromise, can affect their life, can compromise their ability to get the treatment that they need for their cancer. And so the most important thing is that we can be vigilant. We want our patients to stay engaged with us. We're happy to talk about these things. We want to do everything that we can to keep you safe. And kind of keep you going on your journey. So with that, I will stop. Just a reminder, we're here at Christiana Care to help in all aspects. And then, we're here specifically at the Helen Graham Cancer Center for, to help our patients with cancer through a variety of things.
Great. Thank you so much, Dr. Margiotta. And it was really important to remember, I think, just checking with your health provider about the vaccines. And also, again, just the point that talking with those, your caregivers, your family members in your home, and making sure they're vaccinated as well. So thank you. We appreciate the updates, and thank you for joining us.
Great. Thank you for having me.